This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. It's the talk of the town these days, particularly in the medical world, with the potential to cure various illnesses such as diabetes, Alzheimer's, stroke, and heart ailments among many others. Stem cell treatment is starting to gain prominence not just in Europe and the US, but also in the Philippines. Stem cell therapy introduces new cells in the body to repair and regenerate damaged or injured tissues.
It has not been proven yet to cure, but results have shown that there are improvements in these various diseases. It may be used as an adjunct. It is not an alternative. That is one thing that we want to get clear, because others may think that the stem cell is a cure for all. It is not.
Among those claiming to have benefited from stem cell therapy are former Press Secretary Jess Dureza and his wife Elizabeth. In December of 2012, the couple decided to undergo stem cell therapy.
Nag-shrink yung kidneys niya. It was on a downtrend, no? Dumating na hanggang 19% yata. 19 yung bilang. Pag dumating ka sa 15, according to our doctors, magda-dialysis ka na o magta-transplant ka na. So we decided to take a move dahil ang background din yan ganito. Dahil yung doktor namin na nag-asikaso sa kanya, sa kidneys niya, also went and took that treatment in Germany.
8 months later, both claimed to have better health, with most of their ailments allegedly gone.
So there was a rebound. Well, of course, yung well-being niya is very apparent. No? Nawala na rin yung kanyang migraine, which is the one that keeps her always, well-being niya hindi masyado maganda.
Despite its supposed success, the Department of Health, or DOH, however, warns the public that claims of preventive and curative benefits of stem cell therapy are still being further studied. The DOH also cautions the public from receiving stem cell treatments from unaccredited sources.
Now, what we are usually advising the patient is that don't attempt to have the stem cell treatment not until you have been treated by the standard procedures like medicines. If you need surgery for a tumor, you need to have that. If you need chemotherapy, if you need radiation treatment, you need drugs to treat your disease, you have to undergo this treatment.
How effective and reliable is stem cell therapy? Is stem cell therapy the future of medical treatments? Find out the answers tonight on MedTalk. Joining us tonight is Dr. Cristina Puyat, Medical Director of the Asian Stem Cell Institute. Also with us is Dr. Eric Flores, Head of the Cellular Therapeutics Lab at the Makati Medical Center. Good evening, doctors. Welcome to the show.
Hi, how are you?
Hi, good evening.
Thank you.
Thanks
for having us.
It's our pleasure to have both of you here on the show to talk about stem cell therapy. Yes. Stem cell therapy, what exactly is the fascination and apparent desirability of this kind of treatment?
Okay, first things first, stem cells are undifferentiated cells which has the ability to keep creating itself and maintain its stemness. Now, given the right signals, these stem cells will become progenitor cells and will differentiate into the different bodily organs. Mm-hmm. Okay, so that's the fascinating thing about it, is that it can regenerate. It can replace, it can restore, and it can rejuvenate an organ.
Mm-hmm. Okay. So, yes, Dr.
Stem cells are always in your body.
Okay.
From the time you're a fetus till you die, because they have normal functions in your body, they regenerate tissue. So in all your tissues, including your brain, some cells die and new cells come forward. And stem cells provide this also when you have injury. They repair the tissue. Okay, so stem cells are really part of you already.
It's part of you already because, you know, there's so much information. It's an overwhelming medical treatment. And it's nice to know, and thank you for the information, that it's within us already. It doesn't come from elsewhere. We don't grow it elsewhere to be injected back into our system.
Yes.
This is the fascination about stem cell therapy. How about the desirability? Where does that come from?
Well, there are those that want it for the vanity. That's a big market. And there are those who are sick, and like if you had a heart attack or a stroke or have Parkinson's disease, or you know, even weird diseases like ALS, you're looking for treatments after the standard of care could not give you any more.
Oh, okay.
Yes, I think that's the part of desirability, is when you've exhausted every means of treatment, standard form of treatment, and still nothing happens to you. Then comes the question of, what else can I do? I want something else to help me, and that's where stem cell comes about.
Yes.
So with this help, how long has it been helping individuals either for vanity or for treating ailments and injuries? How long has it been?
Well,
It started even way before 1956 when this Nobel Prize American doctor, Dr. Thomas Donnell, he did syngenic transplantation of bone marrow. Syngenic meaning it was from a twin brother that was put back to the same patient. This was a leukemia patient, and the patient got cured. So it started a long time ago.
But now with the advent of all the information being given about how it can help a patient, it's becoming more and more popular.
yes, because one of the early treatments outside of leukemia used embryonic cells.
Okay, what exactly are
Embryonic cells are embryos. No, they're not born yet. They're basically technical word, 18th or 36 cell, a beginning of a person, okay? And when you abort or when you have a natural miscarriage, then these cells can be used to reconstruct almost any cell in your body.
Oh, okay.
And because of this use, and it's like most of it comes from either abortion or in vitro clinics wherein the fetus is not wanted, it's not even a fetus, the blastocyst is not wanted.
Okay.
Then that's when they use it. And that's why it has become an big ethical dilemma, especially for us Catholics in this
Yes.
country. Yeah.
Yes.
So in this country right now, it's not allowed by the Department of Health.
Okay.
So because of this happened in the U.S.,
Yes.
and so a large push came to develop adult stem cells, which is about 95% of all stem cell treatment is adult stem cell treatment
Okay.
today.
So new stem cell treatments to treat injuries and ailments. Where do
Yes.
these
Yes.
new stem cells or these new adult stem cells come from?
Okay, there are different sources of stem cells. Okay, as the first one, Dr. Flores already said, from embryo. There are other sources, meaning it can come from adult mesenchymal stem cells, and under that are the different sources. Like it can come from your adipose tissue or fat. It can also come from your bone marrow. It can come from peripheral mobilized blood. It can come from skin, from teeth, from brain, and entirely our body. It can come from all over our body because we have it in us. Our bank is ourselves. We have
Yes.
stem cells in ourselves.
Okay.
Yeah.
And because we have stem cells in ourselves, we don't need to get it anymore from other sources. Am I correct?
It's not necessary, yes.
We can grow it ourselves.
Yes.
But there's this talk about getting it from other animals. What is the science maybe or the correct medical practice for this?
Okay, animal stem cell or live cell therapy has been practiced a long time ago also. It started in Swiss by Dr. Paul Nihans, but that center is already closed. Now they do it in Germany, in Mannheim, And basically what they do is, they get essentially the stem cells from sheep and inject it to human beings. But this is a kind of transplantation that you consider xenogenic, meaning it's a xenogenic implant, meaning you're implanting a foreign protein to a human tissue.
Okay. So implanting foreign protein into human tissue, what happens to the human with this foreign protein injected into them?
The animal cells usually do not survive very long. They may survive almost a year or a year, and rarely beyond a year. And which is good, because if the animal cell survives and attaches to your tissue, then you can get a severe disease called graft versus host disease.
Okay, what?
Yeah.
Yes.
So in other words, the cells that we're giving to you are rejecting your body. Then now you have a big problem. So
Yes.
mercifully, almost all the animal cells given die.
Yes, a
Okay.
graft versus host response is a form of allergy. Okay, it's like your body fights those cells because it doesn't consider it as self. Okay, and this can have fatal complications.
So with these fatal complications, have the medical practices been more thorough in recommending what should be injected into humans aside from these animal protein?
Yeah. Basically, human cells should be injected into humans, and the first source is yourself. And if you cannot give cells, you're too sick or unable to give any cells, you can choose somebody else, and the best choice are your siblings, brothers and sisters, because assuming you have the same parents, then your genetic makeup is close to each other. So your best donor are your brothers and sisters, so don't make trouble with them.
Be friends with your brothers and
Yes.
sisters.
Yeah, let me give
Yes.
you another example.
Yes, doctor.
For diabetes, okay, the medicine that was used before was from pigs, porcine, okay, porcine insulin. And then with the advance of the technology, we now have human insulin. Okay, it's the same thing for stem cell therapy. It's probably true that they started with animal stem cell, but then with the advances of therapy, we are now using human stem cells. And being more advanced, we are using our own cells, which is autologous stem cells.
Wow. So which particular body part do we get these cells from? Which area?
You can get them from the blood. So if you're trying to make nerve cells, you get it from the blood. If you want to do what's called cancer immunization, you get it from the blood. Otherwise, you can get it from the bone marrow or from the fat, like Dr. Apuyat said. It can come from the fat. When you get it from the fat, you separate the fat from the stem cells. This is an important step, because if there's any fat left associated with the stem cells and you inject it, especially if you inject it intravenous, then the fat can go to your lungs and give you a pulmonary embolism and actually kill you.
Okay.
Instead of curing you.
Yes.
It can kill
So you have to
Kill
make
you.
sure that what you inject to the person is really pure.
Yeah.
And how does it become pure? What is the process by which you mentioned earlier, we separate the fat from the stem cell, and then
Yeah.
it becomes, you have to inject it in its pure state. So how does
Yes.
it get to that pure state?
We take fat, we take about 250 cc, and then the first step, you spin it down. So most of the fat will stay on the surface, and most of the stem cells stay in the bottom. You throw away the top, keep the bottom, then we hydrolyze all the fat. So all the fat is separated. Then we culture the cells in what we call mesenchymal cell media, food for mesenchymal cells. So only the mesenchymal cells or the bone marrow stem cells live all the other cells die. So within 2 weeks, you have a relatively quite pure product.
Wow. So from 200, you mentioned to, like 200,
250,
Yeah.
200.
How,
yes.
what amount is left?
From 200 cc, we usually can get about 50 million bone marrow stem cells. Yeah.
And that is
So-
good for treating an
Yes.
ailment or injury?
Yeah, if you're not in a hurry, our lab can triple the number. So you, after about 6 to 8 weeks or 5 to 8 weeks, you can end up with 150 million.
Wow, which will grow inside of
More
your body.
numbers, bigger effect.
Yeah, because stem cell, the beauty of stem cell is that stem cell, for it to have its effect, you have to reach the therapeutic threshold. Okay, and what is that therapeutic threshold? Nobody really knows until now.
Okay. So why is there the word such as a therapeutic threshold?
You need to give, right now, the number is between 1 to 3 million cells per kilo.
1 to 3 million cells per kilo.
So
Okay.
if you were, I'm just guessing.
Yes,
Don't
no.
be mad.
No.
So let's say you're 50 kilos, we
Okay.
give you about 150 million.
Okay, and that 150 million will stay with me, will grow inside of me
Yes.
still. How long will that last? How many
First,
years?
what happens, it attaches first. If it attaches and grows, then you have a big effect. If only a certain, let's say half only attached and grow, then you have a less bigger effect. Very little attaches and grows, then you have very, very little effect.
And we can do it all over again.
Yes. So this is not math. This is medicine. Nothing is perfect.
Medicine already.
Okay.
Doctors will go back to that in a
Yes.
little while. Let's answer our Twitter question.
Thank you.
Thank you, doctor, is there a minimum, maximum age for those planning to undergo stem cell therapy?
Okay, there's really no minimum or maximum age. Okay, but for somebody or a patient to undergo stem cell therapy, steps have to be undertaken. You need thorough history taking. You need all the medicines that the patient has been taking, all other treatments that the patient has undergone, and all pertinent social, family history, all of that, even genetics if it involves a certain kind of sickness. And then after evaluating everything, then can the patient undergo stem cell therapy. Okay.
No matter what age.
Yes.
Yes.
Youngest stem cell therapy patient.
Months. If they have umbilical cord cells saved. If not, you can wait. Wait, what do you need it for?
I was about to say maybe as some genetic,
Neurologic
neuro-
abnormality?
maybe a neurological
Yeah,
abnormality.
if they
yes.
don't have umbilical cord cells, if it is life-threatening, let's say the baby, some disease where the patient or the baby dies at 1 year, you can give anybody else's cord blood cells. Because the cord blood cells do not have much immune effect at that time. And this helps the child become normal, go to
Stronger.
school and finish, walk, talk, and go to school.
Thank you, doctor,
Yeah.
for that. One more question we have from Facebook. Many ads say that stem cell treatments can make you look younger. Doctors, can you verify this?
Okay, it is true that a stem cell treatment can make you look younger, but it is not the main purpose why we do it. I mean, okay, usually when a patient undergoes stem cell therapy, like for example, there's a Parkinson patient, okay, that comes and we administer stem cell therapy, his face starts to look young. It's a side effect, or it is something that happens when you give or when you infuse stem cell.
Okay, so it's a side effect. It's not the main effect that you
Yes.
want to achieve.
That's right.
Yes, of course, with Parkinson,
Yes.
we're addressing something else. It's a neurologic problem. But then in so doing, they start to look young. Same thing with a kidney patient.
So it's to treat ailments. What about for those patients who plainly would like to look younger?
Okay, in that aspect, there are a lot of things that you can do for physical rejuvenation. There's Botox, there's fillers, there's fat transfers, there's lasers, cleaning, peeling, healthy lifestyle, vitamins, nutraceuticals, a lot of other things before you can go into stem cell therapy.
So you must
Okay.
go through that list first before you think of stem cell therapy as an
Well,
option.
ideally, because being beautiful is not a major problem. You're not going to die because you just want to look pretty, right? But, you have your own decision. If that's what you really want, then nobody can stop you. But the point is, stem cell is not really just for aesthetic therapy.
Okay. So doctors will talk more about stem cell therapy and the safety that goes into this procedure when MedTalk returns. Did you know that in the last 20 years, more than 20,000 patients have received umbilical cord blood transplants, for the most part treating leukemia and blood disorders in children? Cord blood is a rich source of stem cells and has also been used to treat anemia, lymphoma, and other inherited diseases. It is now even possible for parents to store their newborn's cord blood in the hopes of using it in the future if ever their child or a family member suffers an illness that is treatable by cord blood stem cells. We're back here on MedTalk, still talking about stem cell treatment. Doctors, now let's go to the procedure, the safety measures that one will go through when one has this kind of treatment. Dr. Flores?
Before you even start, we take all kinds of tests. Make sure that you're healthy enough to have it. We have a cardiologist see you if you don't have your own cardiologist. And the important thing, we test for infection. We test for infection in your blood, in your urine, even in your lungs if you're expectorating something. And then we test for HIV. We test for hepatitis B and C. And the reason for this is if you have, and we reject people who have a history or hepatitis antigen.
Okay.
Okay, if they have that, we reject, because what happens is this is especially important for those one-stage stem cell therapy, I mean liposuction, spin it down, and inject. Because if you have hepatitis, the equipment will have hepatitis. So the next patient may get the hepatitis that you gave to the equipment. Mm-hmm. So this is very important for us. And for those doing one-stage stem cell therapy, I think this is a very good idea for you.
What does one-stage
One stage
cell therapy
means they suction, spin it down, and then they take the stem cell part and inject IV.
Okay. That's how fast it is.
Yeah.
Okay.
Before we inject, we test for infection, we test for toxin, we test for mycobacteria, and by the middle of next month, we also check the genes that make sure there's no mutation. We'll do cytogenetics. So these are the international criteria.
Mm-hmm.
So
which
that's
is
what
also
we're
applied
following.
here, and it's done here. All the tests
Yes,
are
all the
listed.
tests are done.
Yeah, it's
Yes.
available in our country.
Oh, that's very good to know,
Yeah,
that they don't have to.
so-
But others prefer to go abroad to have this treatment done. What can you say about that?
Well, what I can say is that we have stem cell therapy here locally in our country, and I think you should support our fellow doctors here that are trying their best to give you what we can. Okay. The funny part is we have patients that come from abroad and they come here because we're able to give better service in terms of our staff. You know how Filipinas are.
Better care,
we're very
no?
caring, and we're malambing. And not only that, we can also not just isolate, but we can expand and manipulate the cells, which is not allowed in a lot of countries abroad, so that by doing that, we're able to give better results.
And in better results, since they're here and the treatment is done here, you can monitor them. And they
Yes.
can get in touch with you and
Because
frequent
a lot of things can happen. Like,
checkups.
for example, you have a specimen and you have to send it to another country. How sure are you that nothing happens to that specimen? That it's not exposed to radiation accidentally, like, it passes through the X-ray belt, or, things like that? Or like there's an interchange somewhere. A lot of things can happen when you send things abroad, okay? And that's one. And then when it gets sent back here, other things can happen too. Not unless the patient really goes to Germany. But then why go to Germany when we already have it here?
So speaking of here, it being very, the treatment already being very available here and as good and even better.
Yeah. There are
than
restrictions
treatments abroad.
outside. It takes you almost 15 years to get the US FDA to approve anything.
That long. And if you're if you have this immediate need to have it done,
Yeah.
then it's best to do it here. Who's accredited to do it here in the country?
The Department of Health will accredit the stem cell labs start after August 30th
31
of this year.
Of this year.
Yes, this month.
Okay. So that's good for the practice.
Yes,
That's
it's
good for the
good.
future of medicine.
And it's good for the safety, quality,
Yes.
And keeps people in line. Yeah.
So you know what, we've been talking about discovering or understanding stem cell therapy a lot more, the safety factors that go with this kind of treatment. What is, in the simplest term or simplest form, how would you describe stem cell therapy?
You first.
In the
Ladies
simplest,
for that. Yes.
in the simplest term, how do I say it? Stem cell belongs to the practice of regenerative medicine. So when you say regenerative, it makes something, it regenerates something. So for me, stem cell is regeneration in the simplest term.
Dr. Flores?
We think of stem cell as an extension of the standard of care. For example, if you have a heart attack and the efficiency of your heart is low, no amount of standard of care can give it back to you, right? So you have congestive heart failure, your activity is limited. We have heart stem cell program to regenerate hearts that have had heart attacks, to bring the function back to normal, which standard of care cannot do. So we see ourselves more as an extension of the standard of care rather than just regenerating people,
Okay.
Yeah.
So it's to bring back the normal function of their organs, their body,
bring
the
you back
quality
from
of
the
life.
edge. Yeah, bring you back from the edge. Yeah.
Yeah, because like when you need stem cells, when you're really sick, you emit signals. You have SDF1s, fractal kinds, and it's telling yourself that, hey, I need some help, okay? And stem cells usually attaches to those signals and fixes it.
Okay, so it fixes it, it brings you back from the edge, it improves, as I said earlier, the quality of your life. The side effect is that it makes you look younger, but
Not
more than
bad.
that, you're happy.
Yeah.
You're happy that you're
Yeah.
able to do normal things and that you're
Yeah.
able to enjoy life.